I'm Kevin. I'm a student at Palmer College, and today we'll be talking about disc herniation. It's important to know about disc herniation so you can recognize the symptoms or signs that you may have a disc herniation and it's time to get help, and also different risk factors that you can help reduce your chances of getting disc herniation, and also basically how chiropractors can help you with your disc herniation pain and how to treat it in a non-surgical manner. First, we'll go over a little about what a disc is. The disc sits between the vertebral bodies. There's 23 of them in the body, and basically they sit between these bodies and they act as shock absorbers, and they also act as like miniature ligaments holding the spine together. And also they act as joints too. When actually you do movement with the spine, they help aid with movement. Over time, disc herniation often is just basically resulting from gradual aging and wear and tear, and it's called disc degeneration. And they dehydrate, the discs dehydrate the older you get, and it makes you more prone to getting disc herniations. And basically, I'll show you a little bit what a disc herniation looks like here from, I got this picture from upswinghealth.com. And you'll see on the right here is a normal disc, and here's the disc right in here. And then on the left here shows a herniated disc, and you can see that the material of the disc is compressing this nerve right here, irritating it. And that really produces symptoms in some people, and that's when they know it's time that they need to get help. Most disc herniations, they occur in the lower back, but sometimes they can actually occur in the neck too. If you have pain that travels to a different area, like the arm or the leg, or you have numbness or some tingling or weakness, that may be a sign that it's time to go get checked by a doctor or a chiropractor to see whether or not your disc is herniated. And basically, most of the time that the disc herniation only affects one side of the body. There's several different risk factors that increase the chances of getting a disc herniation. Having excess weight basically causes a lot more stress on your spine, and it's easier for the disc to herniate. Your occupation, a lot of factory jobs, if you're doing repetitive motion, all the overhead motion constantly, that also can increase your chances of getting a herniated disc. And some people just genetically are predisposed of getting herniated discs. Smoking is another factor. It lessens the oxygen supply to the disc, and basically it causes the disc to be broken down more quickly, therefore leading to an increased chance of a disc herniation. Choosing chiropractic for getting help for herniated disc is important because it's a non-invasive. You don't have to perform surgery right away. You can see if your chiropractor has options that can actually work for you. There's an article I found from spineuniverse.com. It's a journal article, and basically it goes through on how chiropractors, how the appointment's going to go, trying to figure out if you do or don't have a herniated disc. And it also goes through some different techniques, and it shows different options that chiropractors can use to treat herniated disc. There was another journal article that I found from ChiroMT. It's about spinal manipulation and treatment of patients that have actually MRI confirmed disc herniation. The study covered patients that had lumbar herniation, and there was basically 20 patients, and they were between 20 and 50 years old, and they did a study of 5 sessions of receiving chiropractic treatment, and they used a disability index to basically show if they're improving with pain or not improving with pain. And after 5 sessions, it was shown that chiropractic really did help reducing disc herniation pain.